So what is a pulmonary embolism? Well, the first thing that I think of, the words that come to mind are quick, scary death. I'm sure many of you remember the rapper Heavy D. He actually died of a pulmonary embolism. A pulmonary embolism starts out as a blood clot that travels from a deep vein, usually in your legs, and it travels up, all the way up into your lungs. Not every blood clot that breaks off and travels up into the lungs causes death, but usually there is some massive damage there that must be taken care of. Now let's take a look at the deep veins down in the legs. Notice the dark lines in the picture. Blood clots form down in these deep veins, then break off and quickly travel up into the lungs. The lower right image shows the blood clot as it's broken off from the rest of it. It's quickly traveling now up into the lungs. The left image shows the entire pathway as it travels all the way up. The upper right image shows the clot as it travels through the heart into both sides of the lungs. Okay, now let's take a look at damage done from pulmonary embolism. Here we have the inside look of a rat who has not been treated and has experienced an embolism. Looking at the image, you can see the black, which is representing the embolism, and you can see the surrounding tissue. The black clearly stands out here. The next image is of the same rat, however, it has been treated with a drug called RTPA. You can clearly see that the black has gone down in this, thus the drug has helped in treatment. This drug is currently being studied to be used for strokes as well, but there are side effects such as excessive bleeding. This last image here is of a human, and it shows the damage done from a pulmonary embolism in the lungs and around the heart, and it shows that it is quite dramatic and will lead to death if it's this serious. So how do you know if you're having a pulmonary embolism? The answer to that is tricky because some of the symptoms are shared with other issues. Regardless, the symptoms can be shortness of breath and a sharp chest pain that is usually worse when you take a deep breath. In some cases, there may also be a pink foamy mucus that you spit up. You may also experience a quickened pulse, feel anxious or on edge, and sweat more profusely. At this point, you should be seen right away. Even if you have experienced these symptoms in the past, it's not a good idea to leave these symptoms to chance. You should be seen right away by a physician because at this point you may only have minutes to live. So now you're at the hospital, and let's talk about how they're going to diagnose your pulmonary embolism. The first thing they're going to do is probably start out by asking you a few questions about your health history and your symptoms. From here they can determine if you are at high risk for a pulmonary embolism. The next step doctors will take will be to perform tests looking for clots or to rule out other causes of your symptoms. The most common tests to look for these symptoms are blood tests, ultrasounds, spiral CAT scans, EKG, and MRIs. Using these tests, doctors can get a clear picture, literally, of what's going on and truly decide if you are having a pulmonary embolism. At this point, doctors can take action and start treatment. So at this point, doctors have accurately identified the pulmonary embolism, and they're going to start treating it. Usually they start off with some sort of anticoagulant drug, such as heparin, that's administered intravenously. This blood thinner works quickly, but they do not actually thin the blood, but instead just help to stop new clots from forming, which is important. On a previous slide, I mentioned the drug RTPA. It is fast-acting, with 82% of clots treated cleared within 2 hours. Recently it has been considered to use the drug RTPA but administered intravenous bolus, which means in the vein rapidly at once. Their idea is that this will bring faster relief to clots. With drug therapies being more prevalent, we are seeing a decline in surgeries, which is definitely a good thing. So now let's take a look at people that are at a higher risk for getting a pulmonary embolism. You have people with cancer, heart failure, serious burns, bedridden individuals, heavy smokers, and users of birth control due to the estrogen. Here are some preventative measures you can use to keep from getting blood clots, including the following. Avoid sitting for long periods of time. While traveling, drink extra fluids, but not alcohol or coffee. wear compression stockings if you are at high risk, and take blood thinners as intended. Thank you, and this concludes the presentation. I will now be taking questions.